Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, I'm glad to bring a colleague to you who will discuss the nitty-gritty of breast cancer, especially among Corpers in Nigeria. Please join me to welcome Mr. Toheeb Sodiq. Mr. Toheeb, how are you doing?
I'm good. Glad to meet you. Nice meeting you on this program. I'm delighted to invite me to talk on the breast cancer and the awareness among the couples in Nigeria. Thanks so
Thank
much.
you so much. Thank you. Thank you so much for accepting the invite. It's an honor. As first when you accepted the invite, I thought you were a female, and I'm glad. I thought the guest researcher is a female, so I'm glad that for some time now we've been discussing cancer, different types of cancer, and it has been females discussing. So I'm glad that a male is on board, and it's a male discussing breast cancer. I'm glad we are going to be learning, getting the male perspective of breast cancer today. So before we dive into discussion, let's give our guest an overview of Mr. Toheeb's profile. Mr. Toheeb Sodiq is a dedicated and passionate individual who has earned his degree in pharmacology with first class honor from Bauchi State University in Nigeria. With a strong desire for quality education, he volunteers enthusiastically focusing on providing high quality instruction to students. His curiosity and eagerness to learn drive him to be constantly inventive and willing to take on new challenges. Mr. Toheeb's unique blend of skills and experience sets him apart. He excels as a talented educator, researcher, and leader with a profound aspiration to make a positive impact on the world. His captivating passion and inspiring dedication to creating a better world are truly evident. Mr. Toheeb is particularly motivated to advance his understanding on cancer drug discovery and design and neuropharmacology. He has published 9 groundbreaking articles in his field demonstrating his passion for research and commitment to advancing knowledge. With his expertise and dedication, Mr. Toheeb is poised to make significant contributions to the scientific community. Beautiful biography, Mr. Toheeb. Well done on your job so far in the field of science and also the field of research. Before we start discussing and the topic for today, let's see what global citizens are saying about breast cancer. I get diverse views, not only from Nigeria, but also from outside Nigeria, what people are saying about whatever we have to discuss for the day. The first is from Sports News and Videos, where they said incorporating 5,000 steps into your daily routine can significantly contribute to reducing breast cancer risk. Regular physical activity not only strengthens your body, but also boosts immunity and overall health. Prioritize movement for a healthier future. We cannot overemphasize the benefits of exercise to every organ in the body, and especially to our general well-being, mental, physical, psychological well-being. And it's encouraged. That's why we encourage people not to have sedentary lifestyle, to keep on moving. Another tweet is from Mukhtar Chief Reversal, where he said, for hair relaxers, recent studies from NIH, Black Women's Health Study, linked frequent use of uterine breast cancer risk to Black women with less regulation in Africa, amplifying concerns. I still don't know why more advocacy is not done. I don't think enough advocacy is done on relaxer use in not just Nigeria, among Black women. Like, we're encouraged because we want to look like a certain race, maybe. But even though there are different reasons why people use relaxers, I remember there are some women, let me not personalize, there are some women that have extra thick hard hair, where relaxers help them able to maintain their hair, make it easier for them to maintain their hair. But I feel some people would rather endure the difficulty in taking care of their hair if they know the effects of using relaxer long term. I'm one of those who stopped using relaxers recently too because of the research, the more advocacy about the research that is coming out on cancers and how it's affecting Black women. So I believe with platforms like this, people will be able to create more awareness on cancers and the factors that might increase your chances as a woman, especially as a Black woman, to have cancer. So the last tweet is from Debbie Bright, where she said, "Cancer doesn't care how much money you have." Ask Sir Paul McCartney. His beloved wife, Linda, died of breast cancer in the 1990s, and she has access to every available treatment. The fact that this hateful admin has creepy RFK Jr. cutting cancer research is so cruel. So currently, RFK Jr. I guess is the one in charge of public health in United States, and some people still are not like pushing for more funding for breast cancer, and it doesn't matter. One thing is, when a disease happens, it depends on the stage you get it. You might be surrounded with consultants, you might be surrounded with the best facilities, but if it's at the last stage, they can just give you what are they calling? I've forgotten what's the last stage, what is given at the last stage.
Palliative therapy.
Palliative therapy. So basically that is it. So Mr. Toheeb, now let's dive deeper into the discussion. You discussed, your paper was on breast cancer among awareness among NYC for our non-Nigerian audience, because you have non-Nigerian audience. It's a mandatory 1-year military training after your first degree in Nigeria. So we are going to discuss, the publication is about breast cancer awareness among females, right?
Yeah, exactly.
Who are doing the 1-year military training after their first degree in Nigeria. So, Mr. Toheeb, what are 3 things we should know about breast cancer?
Thank you very much.
What are 3 things about breast cancer?
Thank you very much for this, your wonderful questions. Cancer generally, they are disease that grows uncontrollably in the body system and can metastasize to any body system. So one thing we should know, the 3 things we should know about the breast cancer is that it's a disease. So it's a type of malignancy that's developed in the breast, and it's spread to the breast tissues, to other part of the body, forming a tumor. So there is one they say that all cancers are tumor, while all tumor are not cancers. So with that, we should know that a breast cancer is a kind of disease in which the body cells or the tissues grow uncontrollably and forming tumor in the body system. That's number 1. And number 2 is this. Breast cancer, people all know breast cancer. Breast cancer is more peculiar to women. And this time around, I want to let you know that breast cancer does not only affect women, it does affect men too. So another thing is breast cancer, the early detection about the breast cancer. People tend to have this breast cancer, and a lot of people die. When we delve deeper, you understand the statistics. So people tend to have more death mortality in breast cancer as a result of lack of awareness and the late presentation of the symptoms. So with that, when early detection also saves lives in breast cancer. So in short, 3 things you should know: that breast cancer is a type of malignancy that originates from the breast tissues and breast cells and multiply uncontrollably and spread and forming tumor in the body system. That's number 1. Number 2 is that male also have breast cancer, not only female. And another thing is that early detection saves lives in breast cancer. Thank you very much.
Thank you so much, Mr. Toheeb, for highlighting those key points about breast cancer among women, and also most especially for highlighting, because when you talk about breast cancer, what people don't think about, females. Why males also have breast cancer? And which leads us to our next question, Mr. Toheeb. What's the difference between the male and female breast cancer, if any?
female breast cancer is very common. We all know that. So female cancer is very common as a result of the exposure to the estrogen, in which, but whereas the male breast cancer, it only accounts for 1%. Because there's a research I did also in my undergrad thesis. I did the research on the breast cancer and the management and evaluation of breast cancer at the particular federal hospital in Nigeria. So with that research, I tend to all the patients I was able to at least assess their files, and I observed that 2% from out of the patients that I'm able to at least do the research on, is only 2% of them that had this breast cancer. So we can see now that women tends to have more breast cancer with a very little percentage of men with breast cancer. That's 1% or 2%. That's number one. Number two, female cases of breast cancer tends to prevent later, in male cases rather, of breast cancer, it tends to show later because they don't really know, because of the little, the breast is not that big, and the tissue is not that much in the breast. Another thing I want to highlight is this. We call something Klinefelter syndrome. Yeah, Klinefelter syndrome is a situation whereby instead of having 46 chromosomes in male, it tends to have 47 chromosomes with an addition of X chromosomes. When it tends to have that X chromosome, that means there's going to be a reduction of the level of testosterone in the body system and the increase of the estrogen. So when they have the increase of the estrogen in their body system, for men, having an increased level of estrogen in the body system is an high risk of having a breast cancer. So such a patient or such a person with Klinefelter syndrome, it tends to have breast cancer at the same. Yeah. So those are the differences. And those are the different. When you have a Klinefelter syndrome, you observe, I've said it earlier, in Klinefelter syndrome, instead of 46 chromosomes, it's 47 chromosomes, addition of X chromosome, and compared to a woman with normal 46. And another thing is, people with Klinefelter syndrome, it tends to have low testosterone level, increase in estrogen level, infertility sometimes happen to them, and they have high risk of having the breast cancer in the body system compared to female. So those are the differences. Estrogen, most especially in breast cancer, is as a result of estrogen exposure, receptors exposure. So in which, if that thing is present much in the body system of a man, someone have to have an high risk of the breast cancer compared to female. So those are the differences between the men and female breast cancer.
Mr. Toheeb explicitly explained the difference between the male and female breast cancer. And that pushes me to the next question, because I'm glad you are a male, and it's good that I feel a number, let me not assume, because when I read the research, I was like disappointed. Okay, females cannot, and you won't blame them. It's awareness. You can't do what you don't know. And
Exactly.
now you can imagine if such number of women cannot or can only such low statistics can only do self-breast examination. You can imagine for males, that means it will be way lower. So I'm glad this platform is for males and females. So what is the best method? How is a self-breast examination done so that also the males who are watching can also do it on themselves as often as they can?
Yeah, thank you very much. Actually, the breast level examination is a kind of simple thing to do, in which we can be doing in ourselves at least monthly or yearly, as the case may be. So you can just find a mirror in front of you, you stay there and can do like this to check the density, the level of the shape of the breast. And at the same time, you can use your hand here, check it from beneath the armpit here, the level, the surroundings of the breast cancer, the surroundings of the breast. Check if there is any lump, check it beneath the armpit here, round the breast side. And also check if there is any lump present in it. We can check it like that. And also we can as well press the nipple if there is going to be any discharge or something like that. So those are just the simple method of doing the breast level examination. So in case you observe anything that is not there before, so you can go to hospital and present your findings to the consulting doctor. Thank you.
Thank you so much, Mr. Toib, for that. Another way is not another way. While doing the self-breast examination, you can also divide your breast mammary gland into four different
Mm.
aspects, dividing it into four equal aspects, and
Yes,
start
exactly.
and
Start
and
then like this.
and try to massage each region and see if you are going to get any lump or any discharge also from your
Mm.
nipple. You look at the shape of the nipple, you look at the color of the nipple, you look at the area, the skin
Change
around the nipple. Yeah,
the
if
change.
you also
If
check
there
the
is a change in size,
yes, the size, the temperature, the skin. If there is
and
any
there is another
chemical
thing.
discoloration, yes,
We call something puckered breast. Puckered breast in the sense that they tends out to have something like what they call these things. I've forgotten it. So there's going to be an inversion here in the breast. So those are the signs of breast cancer.
yes. So those are the things you look out for, as Mr. Toib explained. You look at
Yeah,
the
dimple.
size, you look at
Breast with dimples. Now I remember. Dimple breast. Yeah.
yes, yes. Um, Not just for male or females. You look at the size, compare the two sizes, look at the color, look at if there is any inversion, look at if there is any swelling, look at it if there is any discoloration. Discoloration is if there is any change in color. If one place is darker than the other, so
Yeah.
you go to see your doctor. So you should check your breast as often as you can. So thank you so much for that. Mr. Toyib, in your paper, you mentioned that breast cancer is a public health concern. Aside from the ignorance a lot of females during NYC have about breast cancer,
Yeah.
why is breast cancer a public health concern from your perspective?
Yeah. Thank you. Thank you very much. According to my research, I observed that in 2002, 12.5 deaths, 12.5% of all deaths in Nigeria is as a result of all this breast cancer. You can see, I imagine 12.5% as a result of all this breast cancer. You can see it's a public threat. And another thing, in 2005, 89,000 people lost their life to this breast cancer, according to the World Health Organization in 2005. So we now check what is actually causing these things and why increase in the number. I told you earlier in 2002 it is 12.5% of all the deaths that happened in Nigeria, and in 2005 again, 89% of death cases as a result of this breast cancer. And breast cancer is the most leading cancer, causes death worldwide. So with that, is a public threat. It's a public that we must address all these things. So it's one of the leading causes of death in our society, and it places every economic burden. Yes, it places every economic burden in our body. You can't imagine how much. You said it earlier in the introductory part. You can't imagine how much they are using it in this and the treatment of all this cancer. So the kind of money going for radiotherapy, surgery, chemotherapy, and all. So that's the reason why it presents an heavy economic burden in our body, in the public health entirely. So all these things, those are the reasons why the breast cancer is a public threat. Because among all the cancers, breast cancer is the second most common breast cancer, is the second most common cancer worldwide. And being the second most common cancer, is the number one that is causing all the cancerous cancer cells lead in this Nigeria. Not only Nigeria, worldwide. That all these things are said by the World Health Organization. So you can't imagine losing all these lives. And they predicted that in every year especially in Nigeria, in every year we'll be having like 10,000, 100,000 people losing their life to breast cancer. So you can see it's a threat, and we have to look at it critically to find a long-lasting solution into this disease. Thank you.
Thank you so much for that beautiful answer, Mr. Toyib. We can't not ignore the morbidity and mortality rate of breast cancer
Yeah,
globally, and especially in
yeah,
Nigeria. That takes us back to the question we did on breast cancer examination. At what age, because prevention is better than cure, at what age should we start breast cancer examination, Mr. Toyib?
yeah. Thank you. Actually, the normal guideline for starting the breast self-examination is 20 years. is 20 years. You think we can be doing monthly? So when you at the age of 20 and above, you can start doing your breast self-examination, as explained earlier, that placing your hand, checking if there is anything strange in the body, in the breast. So from 20 years and above, it is advised you should be doing your breast self-examination monthly. Yes. So it's a very simple thing. At your menstrual, whenever you finish your menstruation, can be okay. The last day that I finish my menstruation, I'll be doing my breast self-examination. So whenever you finish your menstruation this month, you do your breast self-examination the following month. So you continue doing that. So with that, at 20 years and above, you'll be doing it monthly, and before you know, you are even something you can be doing every month. So that's number one. Number two, when you're now 20 to 39 years, if it is 20 to 39 years, it is advisable to go for clinical breast examination. You know, there is difference between breast self-examination, that's the one you do by yourself, and the clinical breast examination is the one that is done by clinician. So it is advisable to go for clinical breast examination at least one or within 3 years. Either one time or two times or three times. Once within 3 years, it is advisable for you to go for clinical breast examination. And when it comes to 40 years and above, it is advised, especially for someone that has a family history of breast cancer, to go for mammography. So mammography for 40 years and above. So simple thing, at age of 20, you do your breast examination monthly. At the age of 20 to 39, it is advisable to go for clinical breast examination at least one in 3 years. And 40 years and above, you go for mammography. Thank you.
Thank you so much for explaining that explicitly, Mr. Toheeb. I believe our viewers, our audience are getting all the information when they should start self-breast examination and when they should start clinical breast examination. Mr. Toheeb, we from the paper, you highlighted from the paper that you highlighted the multifaceted nature of this cancer. Please shed more light on this.
Yeah, I said multifaceted nature of this breast cancer, in the sense that, when we have malaria, we know that malaria is being caused by the flies, and we tend to treat it with our all this normal anti-malaria, this artemether, and the rest. But multifaceted in the sense that what causes breast cancer is not as a result of one thing, that's a result of accumulation of a lot of things. It might be genetic factors, it might be environmental factors, it might be lifestyle risk, and some other things like that, in which it is very difficult for us to treat. That's number one. This one is multifaceted. Number two is this. In treatment of cancer, we have stage 1 cancer, we have stage 2 cancer, breast cancer specifically. We have stage 3. Some say we have stage 0 to 4. Some say we have stage 1 to 4. So as the case may be. So does it involve, it's not something you'll be treating with only chemotherapy. Yeah, it's not something, for instance, someone that already have in stage 4, we made mention of something earlier, like palliative therapy, or the cancerous that has already metastasized, that's left the primary region to another body system, and you are treating that with your chemotherapy. You are just deceiving yourself. Even though you are deceiving yourself, that's the reason why the breast cancer is a multifaceted thing, that you should know the proper approach when you want to treat it. You should know the type of stage, in which stage it is. You should go for proper medication, if it is medication, if it is radiotherapy, and if it is ultrasound. Everything you want to do it perfectly to know the kind of breast cancer, to know the kind of stage that you want to treat. So that's the reason why this breast cancer is multifaceted. And in stage 1, the lymph node, we only have the lymph node, only the cancerous cell rather only affect like 2 centimeters, and the lymph node it hasn't entered to the breast really in the stage 1. So, but when you get to stage 2, these cancerous cells, it has entered into the lymph node to like 1 to 3 lymph node has been affected, and up to like 4 to 5 centimeters of these cancerous cells are there already. And another thing is this: in stage 3, like 5 centimeters has been affected, and 4 to 9 lymph node has been affected. So you can see all these stages All these stages is what someone should understand before you can say you want to treat your breast cancer. So that's just the reason why it is multifaceted. Thank you.
Thank you so much for explaining explicitly the term multifaceted aspect of breast cancer. Would like to know the preventive strategies because we've talked about prevention is better than cure and also self breast examination. What are the preventive strategies of breast cancer?
Yeah, it's something that we all do, or we can still do, we can still continue doing. So the preventative strategy is number one, our lifestyle modifications is very, very important. Our lifestyle modifications in the sense that we should indulge ourselves in doing the regular exercise. Yeah, regular exercise it helps very well. Another thing is stop intake. You shouldn't take the alcohol. Stop smoking, and don't smoke, don't drink alcohol, and check and do your regular exercise. That's number one. Number two, you can this thing is somehow funny. You should be doing your regular training properly. So those are we've said it earlier that when you are doing those is your breast examination or the kind, maybe you will be able to detect it early. So when you are doing this screening properly, you'll be able to at least detect what actually happened. If there's any changes, if there is anything strange in your breast, if you have by that time, you have no. So that's another thing. And another thing that is not that common is early childbirth. Yeah. So early childbirth will reduce you to the being increase in the risk of the estrogen. So when you have your child at an early stage, at least it's prevent is one of the strategies that we can use in the prevention of this breast cancer. Another thing is genetic counseling. For someone, I said it earlier, for someone with a family history of breast cancer, part of those are the one of the factors of this breast cancer that is what is our genetic, is our gene, hereditary. Because I think, even if I'm not mistaken, the 5 to 10, I think, or 5 to 12% of the cases with breast cancer is as a result of family history. So people with family history also, they are encouraged to go for genetic counseling to know if they are prompt to all this breast cancer or they are not prompt to. So those are the reasons.
Thank you so much for that, Mr. Toheeb. In the paper, you mentioned willful nulliparity. I want you to highlight our audience. What is willful nulliparity and how does it contribute to breast cancer?
Yeah, although that willful nulliparity here in Nigeria is not that common. I only see some rare cases of someone that is going to be having that willful nulliparity. So in a nutshell, willful nulliparity just means a woman that just wish that I'm not going to have a child, doesn't want to have any children. So it's not going to have any children. She just decided that, oh, for me, I'm not going to have any children. So that in a nutshell, that's just the meaning of willful nulliparity. And as a result to the breast cancer is this: when you decide not to have children, that means there's going to be the increase in the sex hormone level in the body system, most especially the estrogen. Yeah. So, and increase in the estrogen in the body system will expose the person to have an high risk of breast cancer. So that's the correlation. Willful nulliparity in breast cancer, that's just the correlations.
What factors, Mr. what factors contribute to a woman developing breast cancer?
Yeah, thank you very much. There are a lot of factors. I think I mentioned one earlier. A lot of factors.
Extensively. That's why I'm even covering the questions that follows.
Yeah, there are a lot of factors like that contribute to the breast cancer. A lot of them, but number one is the genetic factor. Yeah, genetic factor, whereby like as an hereditary, I said like 5 to 12% of cancer cases are the result of the genetic factor. Like BRCA1, BRCA1, BRCA2. These are the genes. When you are working with breast cancer, you should know all this BRCA. So BRCA1, BRCA2, patient with something like that. Another thing is mutations. Yeah, mutations, and there are some things like that. Another thing is these are hormonal factor. hormonal factor. We call something early menarche, as a result whereby the woman tends to have a menstrual before the age of 12. So when we have a situation like that, the hormonal factor I said earlier. So when you have a situation like the early menarche, the woman tends to have a menstrual before the age of 12. It has exposed the person. To a high risk of the estrogen. So when you have high risk of estrogen in the body system, it tends to have an high risk of what? Of the breast cancer in the body system. So another thing is the lifestyle. Our normal lifestyle, what we take, we especially in Nigeria, we take a lot of junks. So all these junks, they are also a factors, and also obesity. Obesity. When you are obese in nature, and as well dense breast, when you have a lot of like a dense one. So those are the factors that are it is someone with a dense breast compared to someone with a little breast. So someone with dense breast have an high tendency of having a breast cancer. And also about the among the factors there, it is age. Yes, the increase in the age, especially like 50 or 70 and above in women, they have high risk of having this breast cancer. So consumption of what we eat, intake of alcohol and smoking, environmental exposure like radiations, a lot of it like that. So they are all the factors that are contributing to this breast cancer.
Thank you so much for that, Mr. Toyeeb. I wanted to highlight that nulliparity, with regards to taking us a bit back to the question before this, it affects females only, to the best of my knowledge. It doesn't affect male. So if I a male and you're like, we're not getting married, we're not giving birth to children, you're not really affected by nulliparity being increasing your chances of having breast cancer as compared to a female. So, in as
Yes.
much as about breast cancer is male and female, is good for us to highlight that. So, Mr. Toyib, when a woman gets, or when someone gets breast cancer, one of the things they undergo is radiotherapy. How do you convince someone who has breast cancer to go for radiotherapy despite the complications?
Yeah, thank you very much. I said it earlier that during the treatment of the breast cancer is the multifaceted, because we don't apply only chemotherapy. We do radiotherapy, surgery, as the case may be. But radiotherapy reduces the risk of cancer returning. When you see a patient that want to go for radiotherapy and said, I'm not going for radiotherapy or some things like that, you just have to let the person know that this radiotherapy is a very good approach that's going to reduce the risk of the cancer returning, because there are some cases that you treat the cancer and it's going to reoccur again. So radiotherapy is a very good approach in terms of reducing the risk of the cancer return. And another thing is this: a long-term health survivor. When you have a long-term health survivor and they want to reduce this cancer, so giving this radiotherapy will be a very good approach for the person. And describe radiotherapy is a simple approach. It's not an ambiguous approach. You just have to find yourself and pay for it, and at least the cancer is not there again. Thank you. Compared to chemotherapy, chemotherapy, taking cyclophosphamide, chlorambucil, methotrexate, and the rest, then we have some side effects and some other things. But if you go to radiotherapy, it's far better compared to chemo. Thank you.
Thank you so much for that. I've also for highlighting that chemotherapy, every drug, every part you take has its own has its own. I don't want to say complication. Let's just say like side effect, and it's left to your physician to give you to advise you on the best route to take. If you're taking one, if you're taking a combination of both. And to tell you how to, if you have the side effects, how you manage it, so you have a better well-being as a man or a woman. Okay, Mr. Toyib, from the paper, you said 50% of the corpers, of the people there is research on, they never heard of breast cancer, which is funny to me, because how someone from primary school, how someone not going through the educational level, university, and they've never heard of breast cancer. I know cancer might be common. To me, I feel it's common. It's even more common than malaria. But 15%, 15% is a large number saying they've never heard of breast cancer. What factors
Yeah,
contribute to
I was also surprised. I was surprised seeing like we have like 15% of them not have heard about the breast cancer before. Like, yeah, oh, bro, man, you are literate, and why don't you even heard about the breast cancer? And those are the gaps that this research want to at least figure out to let us know the awareness and the proper way of doing the breast examination. So I think what contributed to that is number one is low health literacy. Low health literacy. Most of them, they don't even take cognizance of their bodies, of all these health. They only know of HIV/AIDS. They only know malaria because those are commons. They only know malaria, they know typhoid, but breast examination. I was surprised too. I said it earlier that they've not even heard about the breast cancer. That number one is low health literacy. Number two is limited outreach. Not all of us are privileged to live in the cities. Some are living inside bush. I'm telling you this, I don't know if you come across something earlier. I come across something earlier on social media about Azeezat tribe or something. Yes, Azeezat tribe in Tanzania. Yes, in that tribe, I think they don't even know something via smartphone or televisions or something like. So you can tell that all those tribes like Azeezat tribe in Tanzania that living their life in the bush. Now tell me, if you ask them about breast cancer, they'll be like, "What is that?" Because they've not even heard about it before. So I think those are the limited outreach. Yeah, limited outreach. In which, for instance, someone have gone there before to at least orientate them, to let them know about the breast cancer, must have heard about it. I think maybe those are the factors that contributed to all those people that mentioned that they've not heard about the breast cancer before. So number two is what? Number two is limited outreach. And number three is cultural belief and stigma. Yeah, some believe they don't even know about breast cancer. They believe if it is breast cancer that is affecting them, they don't even know it is breast cancer. They will think it's something else. You understand what I'm trying to say? So all those, I think those are the factors that contributed for letting them not know about the breast cancer. Limited outreach, low health literacy, and cultural belief and stigma. So that's my suggestion though. I don't know if you have anything to add.
Mr. Toib, actually, you said it. I feel Nigeria as a country, we are doing a lot of advocacy. I feel we are doing lots of advocacy on breast cancer awareness, because when you go to health institutions, even primary health centers, you see posters, flyers of breast cancer on the walls. I feel we are doing a lot of advocacy, but I feel we still need to do more advocacy. Not just through social media, because
Exactly.
not everyone has access to internet. Not everyone has money, even though they have access. Not anyone has money to afford internet. More advocacy via radios, via community health leaders, via religious leaders. Like on Friday, the imam can can augment his lecture at the end, talk a bit about breast cancer, or maybe the female women leaders, because also breast cancer also affects males. So the male and the female religious leaders can come in, the cultural leaders. And that's where collaboration come in. I talk about collaboration a lot because no institution can do it alone. The government cannot do it alone. Religious leaders cannot do it alone. All stakeholders need to put their hand on deck to make sure that all citizens are healthy, to make sure that current and future global citizens have better and healthier lifestyle. So, Mr. Toibi said it. It's surprising. And if 50% say they don't know because not all of us are pharmacists, not all of us are doctors. And if someone studied art in school, art, I mean, maybe like what are the forms of art?
It's like
Yes, or maybe
studying English, mass comm, sciences, all the
or
social sciences.
accounting. Yeah, or accounting in school. You don't expect someone who studied accounting to know breast cancer if she doesn't have a roommate or he doesn't have a roommate who talks about breast cancer, or if no one ever walked up to him or her talk about breast cancer. So I feel we need to have that. We are doing a good job as a nation on cancer eradication, cancer awareness, because there are lots of NGOs coming up on breast cancer awareness. But I feel we need to do more. We're a large population, that's why we need to do more. We're a large population increasing every day. We need to do more advocacy, teaching, investments in, because prevention is better than cure. It's way easier to invest in preventive strategies on breast cancer than to treat breast cancer when an individual has breast cancer. You can imagine if a woman does not even know about breast cancer, how does she prevent it? How does she even do self breast examination? How does she
Exactly.
like, yeah, she can be releasing milk from her nipple and she doesn't know that anything's wrong. Because you're like, oh, I have
It
too
is
much
breast
breast
cancer.
milk. God bless me. God bless me, not knowing anything is wrong with her.
That's what, because
Yes, exactly. Thank you so much for that, Mr. Toy. But this takes me to the last question, which I always ask our guest researchers. Where do you see um, breast cancer management as a country in the next decade? Where do you see Nigeria on breast cancer management in a decade?
I that's a lot of questions. It covers a lot of places, but I just summarize it in one response. That I just to increase the level of the research, the local research in Nigeria, for us to know the specific Nigerian specific risk factors, to know the Nigerian specific risk factor. We know when we increase the local research here in Nigeria, for us to detect the Nigerian specific risk factor, because I said it earlier, there are a lot of risk factors contributing to this breast cancer, but
Okay.
if the government can encourage at least, yes, if the government can at least encourage Nigeria and establish a mammography center, cancer screening center, and all these things, and also encourage these local researchers in detecting the Nigeria specific risk factors. That's one of the another side I want to take a look and at least write something on it, so you can know the Nigerian specific risk factor is going to assist in the management of cancer, breast cancer specifically in Nigeria. And also, I
Okay.
think we can as well strengthen the increase in the health insurance coverage. Some people that have breast cancer, they know that they have breast cancer, but they don't have that financial inability for them to go to hospital. It's a burden to them. So if the government can at least increase or strengthen the health insurance coverage so it can cover all those places also, it's a plus. So I think in the next 10 years, they are going to look at that.
Okay, thank you so much, Mr. Toyib. The guest researchers really have an opinion on where whatever topic we are discussing will be in the next decade. Um, Previous guest researchers have been asking the same question, whether breast cancer or generally cancer. They are not really optimistic, but one thing, I like to be optimistic because Nigeria is advancing and people are getting more education and people are getting more awareness, and more investment is coming in from local and international levels on cancer generally in Nigeria. And I believe with this there will be more research. We cannot undermine the fact that there is little research done in this, and you thank you for mentioning Nigerian specific risk factors to Nigerians on breast cancer. We need to do more research, but I'm optimistic in the next decade we'll have more effective management of breast cancer as a nation. I know I'm not the researcher, but I choose to be optimistic because that's the hope is the only thing we have as humans and also as a nation, as Nigeria. When you come from a country like Nigeria, you have to learn to be hopeful. You invest in
Yeah,
hope. So yes,
definitely.
I am hopeful. I
Yeah,
am hopeful.
definitely. Must be hopeful.
Yes. So, thank you, Mr. Toheeb Sodiq, for sharing your time and sharing your expertise. You made this discussion easy because you know it. That's why you made it. Yes, and I believe our audience enjoyed it as much as I did. Guess global citizens, we looked at Mr. Sodiq Toib's paper during the week. Please, if you've not gone through it, it's quite a simple and interesting paper. It's one of the simplest and most interesting reads I've read in some weeks now. So please go through his paper and share with your colleagues. And not just his paper, also this video for more understanding. Please share with your family and friends. Breast cancer knocks at everyone's door. And when you know how to prevent it and when you know how to take care of yourself, you have a better well-being health-wise as an individual. It's so sad to see that there are some things that can be prevented and it's not done. And you find out that even because we usually overlook it, you find women who have the access to the services, access to preventive strategies. They have the money, and because they overlooked it, they get diagnosed at late stage breast cancer. So please, please, please prevent. Practice self breast examination as much as you can. Please don't believe the myth, because there is a myth among women that the more you touch your breast, the more softer it will be and it's going to fall.
That's
The myth, the myth is not true. So please self breast examining yourself. Yes, as a man, as a woman, if you're a couple, you tell your husband to examine you, or the wife examine. If you don't want to examine yourself, because whatever affects the woman affects the family, and whatever affects the family, and that's what we are talking about, the burden of morbidity and mortality of breast cancer in Nigeria. So thank you so much, guest Global Cities, for joining us on this episode of Dr. Fajembola'S opinion. Mr. Toy, do you have a closing statement or I should close it?
You can close it. You can close it.
Okay. Thank you so much for joining us on this episode and have a blessed week.
Thank you very much.